evening, Canterbury. Welcome to Newsmakers Extra. The winds of change are blowing through our healthcare system as the DHB strives to make the very best use of every dollar. Every day in Canterbury, another 13 people turn 65 and another 7 turn 80. The over 65s use half of our total health expenditure and account for 40% of all acute hospital admissions. And Canterbury has one of the largest and fastest ageing populations in New Zealand. So that's quite a challenge in itself. Joining us to discuss these challenges and many others, and the man who is planning to transform healthcare in Canterbury is the Chief Executive of our Health Board, David Mates. Thank you very much for coming in. They're actually quite chilling figures, aren't they, some of those?
They certainly pose a set of major challenges that we need to get a head round if we're going to continue to provide and meet the expectations of health services for our community.
Do you think the region has been in denial or has been trying to defer this reality in recent years?
No, I think it's one of those things that has been a wee bit invisible, but over the last 4 to 5 years we've been working pretty extensively to try and address and meet kind of needs of the elderly in quite different ways. So it's something that is facing most Western health economies, and it's a challenge that's not going to go away.
Why is it that we have, as I mentioned before, one of the largest and fastest ageing populations in this country?
I think there's something to do with the resilience in the South Island and in Canterbury. And I think just in terms of the physical numbers, as a district health board, we're one of the largest in the country, and therefore our total population base of around about 500,000 people, the numbers start demonstrating and showing themselves a lot quicker than elsewhere.
Sure. We'll come back to aged care and some of the battles that have been playing out in the media in recent times a bit later on. Just some background on yourself, David. You've been Chief Executive for how long now?
Coming up about 16 months in Canterbury, and over the last 17 years in a number of different roles from Northland, Wairarapa and the Hawke's Bay, and a very brief time on the West Coast. What
was the attraction to this position?
I think with Canterbury, one of the larger district health boards, it is one of the most innovative, and it is certainly, I think, the best district health board in the country.
Are the health boards competitive amongst themselves?
Yeah, they are to a certain level. I think all district health boards are kind of pushing each other to see how services can be provided in a better and different way. And one of the challenges we do have is we do have a limited health workforce in this country, and the same with most Western health economies. And what we're trying to do here is create the right environment to attract the very best people to work for us.
Do you think we've got too many health boards?
I think it's going to be a challenge going forward as to how we get the right linkages and the right collaboration happening, and that may result in a number of, or potentially a fewer number of district health boards sometime in the future. But the number of district health boards are not necessarily the problem if we can get the services, clinical services, shaped in a way that actually transcends district health board boundaries.
Sure. Looking at some of the big picture stuff, the master plan for hospital facilities over the coming decades. Now there is a two-stage redevelopment proposed for Christchurch Hospital. What's entailed in that, and where are we at?
Well, we're at with some very public consultation at the moment about the Christchurch Hospital, and where we've been really challenged looking at the Christchurch Hospital site is that if we look to the future, if we did nothing and carried on providing services the way we do, we'd need to build a hospital the same size as Christchurch Hospital in addition to what we've got.
Wow.
We'd need another 3,000 aged care beds, and we'd need around about 25% more primary care practices. Now, even if as a country we could afford that, which we can't, there isn't a health workforce that's going to be there to enable us to do that. So a key part is really looking at how we think about services in the future, and a key part of that has been looking at the Christchurch Hospital site as what are the facilities we're going to need for the future, and how do we put those together in a way that is going to meet our community's needs.
Is the redevelopment conditional on that land swap with Hagley Park? Is that quite a vital cog in the whole mix here?
It's absolutely fundamental. We've gone through about 16 or 17 different options on the site, and there is only one that really works. While the other options can work at various stages, they all get to the same problem, but 5, 10, 15 years down the track. And we've got to be very mindful that we don't create a problem for our future generation.
All going to plan. When do you think work will commence on the site?
We're going through extensive public consultation at the moment about the land, kind of the land swap, and that's always a very delicate and delicate process to work through, and it will require an act of Parliament to swap the two pieces of land. We're also needing to look at areas like the Hagley Hostel and the various height of proposed new facilities into the future. So that process is happening, and there'll be public hearings panel in June on that. We've got clinical services planning well and truly underway at the moment, and we will have submitted a full-blown business case by September this year. So it's a very, very tight time frame. Now, given all of that falling into place perfectly, we're then about 5 years from the approval of the business case to the first stage Christchurch Hospital being commissioned.
This has, I read somewhere, a $400 million price tag. Is that money in the bank?
It's around about $400 million, the first stage. We're in a unique position as a district health board that we're probably the only district health board in the country that can sustain that level or support that level of investment.
Right. What about the old Christchurch Women's site in Colombo Street? What's going to happen with that?
Not too sure at the moment. We're working through a process looking at our future facility requirements, and part of that we'll be looking at is the old Christchurch Women's site. Does that have a part to play with future health services or not? If it does, we'll be working through a process there, and if it doesn't, then we're probably not the right land owners to continue to keep that kind of in the district health board. Would
you agree at the moment it looks like a dog's breakfast, that site?
Yes, it does, and it's about to go through a process of being grassed.
Right.
So that should at least tidy up some of the eyesight.
Now, you told the press in November that with regard to Princess Margaret Hospital, a new purpose-built facility is much more appropriate, and Burwood certainly offers an option in terms of space. Does that mean PMH is a gone burger?
It means that we're working through looking at what our future, particularly health services for the elderly, and where those are best located. Now, Princess Margaret certainly has some major challenges, both with norovirus, which is deeply embedded in a number of the wards, and that poses some quite significant risks for patients there. But the facilities themselves are a really good example how not to do them, because it's been rigidly designed, and that's really, really costly to change. So over the next 2 or 3 months, that will start becoming a wee bit clearer as we start defining how we provide the care. But certainly Princess Margaret is a more complex site than Burwood, and certainly our initial thinking is more likely to be looking at Burwood as a long-term option.
So a decision has not been made on that
Decision
yet?
Hasn't been made on that.
But your personal preference would be to walk away from the site?
I think at this stage it is not a site that is going to be easy to develop, and again we've got to look to the future, where the future growth is happening in the city, and where best we can provide cost-effective and affordable health services. And certainly the Burwood site is a lot easier to do that.
You'll be aware that Health Cuts Heard have been in the press quite a few times saying that selling the Cashmere site would be outrageous and short-sighted, and we need to keep a hold of land for future health needs. Any merit in that?
All the planning we're doing at the moment is looking at where we go to over the next 50 years, and certainly the Christchurch site is a really good example of that. While it's hard to believe now, Christchurch Women's, which is only 4 years old, in 50 years' time will be an old facility. How do we think about replacing those? So everything we're doing now is looking, kind of really 30 to 50 years out of what and how we're going to set things up that we don't create a problem for a future generation. So we're doing that with every one of our services and every one of our facilities at the moment.
Okay, we'll take a break. Plenty more to come with David Mates. Do stay with us.